Hi everyone. What world can learn from Kerala to how to fight against COVID-19? This was a trending news in all international media in this week. Even the BBC has an interview with Kerala Health Minister KK Shailaja.
Since the world's largest lockdown, covering 1.3 billion people, appears to have helped keep India's numbers relatively low, with a little over 3,000 deaths and around 96,500 confirmed cases. In the southern state of Kerala, which has a population of 35 million, just 601 cases have been confirmed and only 4 deaths. But the state's health minister, KK Shailaja, has been praised for her ministry's rapid response to the outbreak. Well, KK Shailaja joins us now from Kerala's capital. Thanks very much for joining us here, KK Shailaja. A lot of people are asking questions about why it's been such a success story where you are in terms of keeping the numbers low.
It is because of our proper timely preparation and setting our protocols and guidelines in proper time. So when we heard that newly formed virus,
can you tell me how you actually made your preparations? So what did you do? Did you impose a lockdown before the rest of the country?
We started our preparation of the health department. Once we have our RRT meeting and we opened our control room. At that time, no one returned from Wuhan, but we expect that someone will return because there are so many students studying in Wuhan University, in China, and definitely we can expect that someone will return to Kerala. At that time, we opened
in a state and a place where there's 35 million people, are you testing people regularly so you know of the numbers? How are you knowing so accurately these numbers that you have?
Yes, we have formed a scientific strategy for testing. We are tracing the people from the airport itself, and if they are coming by road, by the checkpost itself, and if they are coming by water from the seaport itself, we are tracing the people. Very good trained team was there, and they are examining the people whether they have any symptoms of corona virus, and if they have some symptoms directly from there, we are lifting the patients to the hospital and isolating them and taking the throat swab and sending the samples for a PCR test in the laboratory.
Do your hospitals have the equipment that's needed, and do your health workers have the protective gear that's needed?
And we have a very good project called Ardram, a mission, and through which the last 4 years we are trying very hard to address the problems in local level itself. We are converting our primary health centers to family health center, providing sufficient doctors and paramedical staffs and nurses there. We started very good laboratories in primary health center itself.
Are you worried because there are some places in India where the lockdown has started to ease? For example, in Delhi, the rail system is operating again so people can go back to their hometowns. Are you worried that as people start to move, it could spread to a place like Kerala?
We have a very good human resource import from Kerala to the other part of the world, and they are returning to their home state. And we are little much worried because a large number of people are returning at a time, but we are not hesitating. We are ready to receive them and to send them in home quarantine, and with the help of the local self-government and police and health workers, we are watching whether they are following our advisories and guidelines
and your advice. KK Shailaja, thank you very much for joining us.
Kerala, the southern state of India, has a population of 35 million. Per capita income, pound 2,200. Total COVID deaths, 4. UK, the population is 64 million, nearly the double of Kerala. Per capita income is pound 33,000, and total corona deaths so far 36,000. The first case was confirmed on 30th January 2020 in Kerala. In UK, a month later, it was on 28th February. How is the situation now in Kerala? there are less than 10 cases reported per day and no social transmission. The new cases are the people coming from outside Kerala. Why do the Keralites get extra emotional when the foreign media reports about corona? There are some story behind it. This is an English newspaper report on 20th March. The reason was the tourist who was tested positive boarded into an aeroplane to UK. And after 2 weeks, these are the heading of an Indian newspaper, but unfortunately, good news are not shown in English media. But the main point is that how did Kerala successfully contain the spread of corona and some other facts about Kerala? When the reports of corona started in Wuhan, China, Kerala started testing COVID at all its airports, seaports and train stations, quarantined the positive cases and using technology to trace all the contacts and ask them for self-quarantine. It is the police force, the forerunners of corona operation in Kerala, created many public awareness programs, included a hand washing dance and many videos. A mass campaign called Break the Chain has introduced. Now, some important facts about Kerala. Kerala's 30% of nurses are working in US and UK, 50% in Australia and 12% in Middle East. Here is some testimonies about Kerala nurses.
Truth in what we've heard, that we don't recruit enough. I don't have a problem with people coming to work in our country, from overseas. And some of the best nurses that we learn from, actually, are nurses from South India, from Kerala in particular. And of course, we are absolutely and rightly reliant on a huge number of EU nationals that come and work in our NHS.
A 93-year-old man and his 88-year-old wife are the oldest corona survivors in Kerala. 99% of Kerala's senior citizens live with their families, not in care homes. Yes, Kerala matches with US in its health, but not in economy. Despite the success stories, Kerala lost more than 130 Keralites outside of Kerala, 31 in US, 22 in Middle East, and 10 in UK. Among the 10 in UK, 2 were the senior doctors served at the front line. One is a priest who served as a chaplain in a hospital in London, and most of the rest of them are nurses. The mortality rate of Kerala is 0.43%, whereas most of the developed countries are 4 to 5%. The success of Kerala model is not just the immediate action. There are a lot of factors like a high literacy rate, the decentralized healthcare system, root level voluntary work and extensive testing. I hereby conclude my video. I hope you like this video. If you like this video, please subscribe my channel and press the bell button to get the notification. Please share my channel to friends and families, and thanks for watching my video. We will see you next time with another video. Thank you. Bye-bye.